Welcome to this podcast from the Medical Journal of Australia. My name is Sally Block, the MJA's news and online editor. A little over 10 years ago, the Australian Commission on Safety and Quality in Healthcare released its first national clinical care standard. A perspective on the subject is being published in the MJA today, and a webinar is being held tomorrow where the Commission will showcase the 5 stories of excellence discussed in today's podcast. The link to the webinar will be in the show notes. The Chief Medical Officer of the Commission, Conjoint Professor Carolyn Hullick, and its Clinical Care Standards Director, Dr. Alice Bhasale, join me now. Can you give us some background about clinical care standards, the history, and how and why did they start?
So the Commission has a national role to lead safety and quality for Australia. We were formed under the National Health Reform Act, and part of that role is to think about how care is delivered across Australia and variation in different parts of the country, so from rural sites all the way to big metropolitan cities. So the clinical care standards are really about delivering care for people wherever they live and no matter where they are, so they're treated well in Australia. And what we do is we look at the gaps between guidelines and practice, and then we think about what the safety and quality issues are, and then we write a small number of quality statements that are really focused on quality improvement at a local area in order to improve care. So in order to do that, there's quite a big consultation process and collaboration. We have a topic working group who are consumers as well as clinicians and health service managers across the system who have got experience and expertise in the topic. And they come together to advise on what the clinical care standard should look like. And then we have a really extensive consultation process where it goes out and we sometimes get hundreds, if not thousands, of responses in order to really hone down the clinical care standard so that's exactly what people need. So one of the really important things is there's a huge amount of support across the country for the clinical care standards, and they're written in a way from the patient's perspective, but we think about what the patient needs to know, what the clinicians need to know, and what the health system needs to know.
Alice, do you want to add to that?
Yeah, sure. So, clinical care standards are chosen based on national priority areas. So we really try and hit the high topics, the big topics that are causing the most pain across the system. When we look at the data on potentially unwarranted variation, we need to understand the evidence base. So there has to be a good evidence base. We need to know there's variation and really that we're able to make a difference in that chosen topic. So the first clinical care standard was on antimicrobial stewardship, and that was published in November 2014. And the other 2 that came shortly after that were acute coronary syndromes and acute stroke. So you can see they're all high priority areas. And since then, we've had a total of 19 clinical care standards that we've developed. We've got more on the way. And we also do continue to review the standards to make sure that they're up to date and they remain relevant and actionable. So you can have a look on our website if you like. We've got a little 10-year timeline that shows when they were published and updated. And you'll see how the topics have evolved over time. So we started off with a very acute care focus, but we've moved some into primary care. And we've also increasingly trying to think about ways to improve integration and consistency across the system, because that really reflects the patient journey. And I guess one thing about the standards is they also complement the National Safety and Quality Health Service standards. So those are the standards that are used to accredit hospitals, acute services. And while those standards focus on broader systems and processes, the clinical care standards hone in on specific clinical priorities and specific clinical topics.
So the 5 stories of excellence, what are they and why were they chosen?
As we travel around the country, we often hear about the successes and what people are doing really well in regard to the clinical care standards, but we also hear about the issues and the challenges that people are encountering. So we thought at a 10-year mark, it was a really good time to celebrate success and reflect on what we've all learnt, but also share the learnings across the system so that others can actually implement the clinical care standards. So the 5 stories that we've chosen really showcase excellence and innovation, but they're also an opportunity for others to learn. We've developed quite a few different ways, resources that people can access. So we've got some written stories on our website. We've got some short videos. We're having a webinar, and we've also got the MJ articles that we're talking about today. So the perspective article as well as the article we've written on the 10 years of the clinical care standard. The thing that was actually really interesting and pleasing to me was that We sent out expressions of interest for applications, and they really came from right across the country, from small country hospitals right up to the big quaternary level hospitals in the city, and all reflecting some really key themes, I think, that were important for implementation of clinical care standards. So all of them had identified a problem, and they used the clinical care standard in order to improve care. They had to collect data, and then they had to demonstrate improvements, and then also talk about how they've engaged with the system and engaged with all the different stakeholders, because the health system is very complex, and there's often many different players for any clinical condition that requires input from broad teams.
Alice, can you give an overview of the 5 stories of excellence for us?
So we had some really great stories, and I'm just going to go through the 5 of them. So Barwon Health in Victoria is a regional stroke hospital, and they implemented the acute stroke clinical care standard, and the focus that they had was really on improving the timeliness of life-saving thrombolysis or clot-busting therapy. And so they increased the number of people who had therapy within 60 minutes from a low of 19% to 75%. And when you think about the journey that's involved in getting a patient into the hospital and to thrombolysis, that's really quite a remarkable achievement. So they looked at their whole stroke pathway, and they really did a whole engagement piece with everybody from pre-hospital to imaging to admissions processes to improve the timeliness. And a key part of their success was doing a real-time simulation every year to engage all of the clinicians in a practice sort of exercise. Another service which was implementing AMS, so the Canberra Hospital Health Services was implementing the Antimicrobial Stewardship Clinical Care Standard, which is a foundation standard. As I mentioned, it's been around for a while, and they are required to audit yearly. But this team wanted to do more, so they actually established a monthly audit to make sure that patients got the best antimicrobial treatment for their infections. And the key goal there is also to reduce antimicrobial resistance. So in their move to monthly auditing, they were able to identify specific targets, including surgical prophylaxis and a need to address antibiotic allergy delabeling. And they used their electronic medical record to really build changes into the workflow to encourage that guideline-based prescribing. And what stood out for me was their work on antibiotic allergy delabeling. So a lot of people go into hospital with a penicillin allergy that gets recorded on their record that may in fact not be as severe as thought. So they establish a really thoughtful process, and you can read about that and hear about that in the webinar. The other example that was chosen from a small health service was the Northern New South Wales local health district, and they were implementing the colonoscopy clinical care standard. And really the challenge for them was to take on feedback from an accreditation visit and to change their whole approach to monitoring quality in colonoscopy. So they had a process, but really wasn't thorough enough to really address or monitor variations in practice, which is obviously a big part of monitoring quality. And this story is inspiring for a lot of reasons. They had some feedback, but they took it on board and they really rebuilt their whole system of monitoring and reporting quality in colonoscopy in a very collaborative way. And it's a great example of clinicians and governance working together in a sort of win-win way. The 4th example was the Opioid Analgesic Stewardship Program from the Medicines Optimisation Service at Austin Health. So this is a big hospital, and their project set out to improve the number of patients who were discharged from the ED or from surgical settings on first-time opioids who had a clear opioid management plan to hand over to the GP. And we know that a lack of clarity can mean patients are prescribed opioids for much longer than they're intended to be. And there are all the associated risks with that. So as you can see and hear in this example, the project was designed to be sustainable over the long term. So as well as building changes into their workflow, they also built in reporting and monitoring as part of that design. So really great results. They were able to double the number of patients who received an opioid management plan. And the final example was the sepsis clinical care standard implementation by Flinders and Upper North Local Health Network in South Australia. And this was a really great example of how the clinical care standards can actually help to build quality everywhere. So it's a small sort of number numerically, I guess it's a small service, but it takes in a very large area from Roxby Downs to Whyalla in South Australia. It's remote and geographically dispersed with a high turnover of workforce and a lot of junior staff coming and going as well. So after some misdiagnoses led to treatment delays for sepsis, they undertook a full self-assessment and really thought about how they could build a new pathway, build in education and encourage change. And I think they had a dashboard that they used all over the hospital, including, she said, I don't think you could go into that service without understanding what their sepsis results were. They really had them everywhere, and they were very, very passionate about the change. And I think they've had some great results, which is wonderful to see for such a small kind of service.
So, what are the key themes that stood out in the Excellence Awards?
I think I was amazed that there was such diversity in both the hospitals and also the clinical conditions that were the award winners. That wasn't by intent, but it was how it came out. And I think you can also hear and understand their passion for improving care. The three themes that I thought that really stood out to me was collaboration, the use of data and monitoring to improve care, and then the integration of processes and services across the hospital that they could build and sustain into the future rather than being a one-off project. So the first one, I think, collaboration. I think as an emergency physician myself, I think it's actually really important when we want to do quality improvement that the whole of the hospital or the management and leadership particularly are engaged, because often the clinicians might have a good idea or the managers might have a good idea, but unless they're working together, it's actually very difficult to make change. So I think empowering clinicians and leadership to work together. And an example of that is simulation training that Alice has just talked about, where they actually looked at the whole journey from the patient arriving or before the patient arrived with the ambulance service, and then through the emergency department into the imaging department in order to see all the different roadblocks along the way that they needed to improve. Again, the sepsis example, being able to put in a pathway where they have a very high turnover and they have a very high locum workforce, medical workforce. So the nurses really were the leaders in sepsis for that project. The second example is around using data and monitoring, and I think they were able to really use the data meaningfully themselves. I think sometimes in health we try and have a top-down approach to change. We try and tell clinicians what to do, and that's I'm a chief medical officer, but I also recognise that when you try and tell people what to do, it's very unlikely to happen. And we really live in a complex, adaptive kind of system that doesn't respond well to command and control. So I think by empowering clinicians and working with them and thinking about their workflows, we could actually improve care. So a good example for that one was the opioid stewardship program. They recognised that they needed to improve the way they were discharging patients from the hospital and how they were prescribing and using opioids, but by having a plan and a system in place and everyone agreeing and coming together in a round table, they're able to have a common approach to how they would manage opioids in the hospital.
Right. So how do the standards support better, safer care?
I think it's consistency and principles, actually. So we have evidence-based practice. They're often based on national guidelines, but it's around finding the gaps and finding what are the important things that we think from a safety and quality perspective, and being consistent and using those principles wherever the person is. So what does sepsis mean in Roxby Downs is going to be very different to what sepsis means at the Royal Children's Hospital in Melbourne. But the patients are the same and the care that they need is actually the same, but the context is different. So it's that kind of flexible approach to consistent guidelines, I think. I think it's basing the guidelines on important issues for the system. So as Alice has said, we've only got 19 clinical care standards and we've got hundreds, if not thousands, of clinical conditions across the country, but it's picking the big ones. And then I think where patients perceive that our system is a whole system, they don't perceive that there's a hospital system and a community system, and we've worked really hard on the last few clinical care standards to think about the model of care all the way from when a person sees their general practitioner to when they might have surgery. The clinical care standards are based on the latest evidence and that collaborative process, and we also develop some supporting resources to help clinicians and health services with implementation.
So what's in store for the future?
I think we know that the clinical care standards are making a difference. And I think that it's really important that we can support frontline clinicians to do a good job and to use best practice. I think we need to recognise that the system is under strain, and those clinicians particularly are under strain at the moment post-COVID, and that we really need to focus on the important things for clinical priorities and pick the right topics. So we've been through a process of how we allocate topics and how we make sure we're doing the things that are going to make a difference. We've been thinking into the future about all of our responsibilities to close the gap in improving outcomes for Aboriginal and Torres Strait Islander people. And many of the topics that we're looking at, we know that Aboriginal people and Torres Strait Islander people can have health outcomes that are not as good as others. So we really have been thinking about the cultural safety component in regard to the last few clinical care standards. I think we're using the Atlas of Variation in our data better, I think, so that we can help to define the topics but also monitor how they're going. And I think we've got several clinical care standards that are in development at the moment. So colonoscopy is being revised and will come out in September. Acute stroke is going to be released early next year with a revision. And we're working on a new clinical care standard, which is emergency laparotomy.
What are your closing remarks in terms of the standards and guidelines?
I think it's great to celebrate in health. I think we often think about the things that we could do differently or the things that are not as good as it could be. So for me, the 10-year celebration is a really important thing. I think every clinician and every person who works in the health system goes to work to do a really good job. So I think these standards really help to improve that care. We want to raise the bar every day, the way people deliver care in the system. So the things I think I want to encourage clinicians and services to do is to review the clinical care standards and think about how they apply in your workplace. I think reflect on your current practice and think about the data that you can access in order to improve care, and then thinking about modifying care. But I think they're the three steps. And we know that the clinical care standards do offer the clinicians and health system a really clear road for providing care across the whole health system. So I encourage people to use them. And I really want to congratulate the 5 Excellence Awards winners. They were amazing, but also all the applications we received were fantastic. And as I said, I think clinicians go to work every day to do a good job, and by delivering excellent care for patients, it's very rewarding. And thank you to everything people do every day.
I might just add, the examples that we've talked about today, there's a lot more to them, obviously, and I think these services have really got a rich kind of source of information for others to learn from. So I really would encourage people to have a look at our website, look at all the information there, look at the webinar, and really take some inspiration from these stories, because I think they're very, very worthwhile investigating further.
Thank you to my special guests, Conjoint Professor Carolyn Hullick and Dr. Alice Bhasale. The MJA acknowledges the traditional owners and custodians of the land on which we live and work across Australia. This podcast was recorded on the lands of the Wongal people. I pay my respects to their elders past and present. You can find more podcasts on our website at mja.com.au or wherever you find your podcasts. Thank you so much for listening.